Ladies and gentlemen, dear guests, it's a great pleasure for me to present our achievements in the our otorhinolaryngology specialty in the world of medicine. I represent Medincus Center of Hearing and Speech Network, which consists of several centers in our country with headquarters in center of Poland, in Kajetanów, close to Warsaw, and that number is 15 centers in Poland with hospital facility. So we try to take care of the patients with problems with nose, with hearing, with ear, and with the throat, with voice. Additional, we also created 8 centers abroad, and we started from Ukraine, Odessa. Now we have 3 branches there. Also we have centers in Central Asia, like in Kyrgyzstan, in Kazakhstan, and just recently we also started to operate in West Africa. That what is very important, that we provide service from 19 years, and we try to do everything under one roof. So starting from diagnostic through treatment, including surgery, till rehabilitation, which quite often, especially during the COVID-19 era, it's also supported with solution. Numbers, there is 150 ENT specialists, including audiologists, audioprothesists, speech therapeutists, so the whole variety of people who take care of the patient on each stage of their clinical pathway. There is 2,500 surgical procedures and 150,000 annually. So we go through diagnostic, we go through surgery, rehabilitation, and additional, we also do educational courses. So we want to prepare people who go to the market and who will be our partners, our patients, or people with whom we cooperate about how to do it, and also to do as high possible technology as possible for our patients. Some special features which I would like to underline is the TELEFITTING. It's a system for remote fitting for speech processors. How it works? We have patients who is fully deaf, and the TELEFITTING is for cochlear implants. So the patient is after the surgery, and there is the implant in the inner ear of the patient, and after that, that sounds and voice go through the speech processor, which is located behind the ear. And sometimes some patients go to some centers, they have fitting exactly one after the surgery, and that's all. We try to make the speech understanding for the people much better. So we try to adjust that stimulation for hearing, which is the best in moment of rehabilitation. So we do it remotely. Before that, patients had to come to center, to headquarters, and to do it routinely. Now they could do it remotely. We created the first in the world national network of teleaudiology. So it was 20 centers in Poland, 8 abroad, and it was with some of our partners and also some national institutions. It was awarded with several gold medals, with special innovation fairs in several congresses, and especially innovation fairs, including fairs in Asia. Also, it was awarded by Computer World Achievement of the 21st Century some years ago. And another issue, which is extremely important in small children, in newborns, when we need to know if they hear or if they don't hear. For example, after the hearing screening, which is quite often and quite common after a newborn screening, we know that something is going wrong. So we want to support parents with the good knowledge of what's going on. So we don't want to waste time if there isn't a problem. So there is objective measurement for children, and we can put the electrodes and we can transmit signal telemedically, and we could analyze that. It's extremely important for them, and we can give the answer quite fast. So there's no need to travel, and if there is some team who is prepared, they could do it individually, and we could support them with the interpretation and with the checking if the research and examination was performed properly. Another quite important and novel therapy, also awarded plenty of times, is the SPPS-S therapy. There is therapy dedicated for children with central disorders in the hearing. So they have good hearing, they could hear, they could know there's something going around them, but they have not enough good speech understanding in terms of the interpretation of that what is going in the school, for example. They have some problem with the behavior, they have sometimes worse marks at school, and it's quite common in child with who has quite often the laptop or mobile phone or smartphone with a lot of games, so there is some interpretation point of view, and I think it's a matter of time that they could have some problems also with that disorder. So we did the therapy, which is especially very nice supported with the solution. They could do it at home. We also have the equipment for hearing screening, for speech and vision screening, which dedicate for school children. We try to do it at the beginning of their educational pathway. So there are some programs in Poland and in different continents, including Asia and Africa and South America. And quite recent achievement, there is sense examination capsule. This is dedicated for places where we would like to do quite fast screening for 5 senses, so hearing, vision, smell, taste, and balance. So with the capsule, you could put it in the place like in clinic or also in the pharmacy or some other places, and you could have some quite fast screening. Now we adjust that solution for the COVID time, so there will be as much possible solution which will be safe from in the COVID. We have a lot of cooperation with Taiwan, including some publication. We were plenty of times and participate in many conferences. Also, our colleagues from Taiwan, they come to our congresses, which, for example, was some years ago was Pulitzer Society meeting, was World Congress of Otology. There also was dedicated panel, Otology in Taiwan, which was moderated by Professor Xiao. Participation of a lot of courses, so we teach them and we change experience, including the surgical experience, and also some patients after the treatment of surgical treatment in Taiwan, they came to us to show how they work and how they have good hearing and speech after rehabilitation, and they took part in musician festival conference Beats of Kohla in 2017 and 18. Our participation was, for example, at the conference, which was in Taiwan in 2015, in 2019 and 2018, and now together we cooperate to support Taiwan to host one of the World Congress soon in Taipei, dedicated for tinnitus. Thank you very much for your attention, and I wish you good day and good luck in all your dreams.